You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. How has been your day? Today I'm going to discuss real fertility issues that, oftentimes occur during the process of in vitro fertilization. Okay, so the topic for today is no other one but empty follicle syndrome. How many of you are hearing that for the first time? Well, for few women that have done IVF before, yes, this usually is a concern, okay? Empty follicle syndrome is defined as a condition in which no eggs are retrieved from a matured ovarian follicle with apparently normal follicular development. Even with good AMH, empty follicle syndrome could still occur, even despite repeated aspiration and flushing. Yeah, it is a very rare incident. Say about 0 to 2 to 7%. And the reason for this cannot also be explained sometimes, okay? But many a times, a lot of reasons, okay, could actually be attributed to this. Okay, so this brings me to the type of empty follicle syndrome that is available. Okay, there are two types. There is the first empty follicle syndrome, and there is the genuine one. Okay, so ability to now decide whether the inability to get the good eggs out of your follicle is due to any of these, yes, will now rest on your doctor. Okay, so let's talk about the first one, the first empty follicle syndrome and the genuine empty follicle syndrome. Okay, so that we don't complicate things, I'll be using the word GEFS for genuine empty follicle syndrome, and I will be using the word FEFS for first empty follicle syndrome. So let's talk about GEFS. It is defined as failure to retrieve eggs from mature follicle after apparently normal folliculogenesis and sterogenesis with optimal beta HCG level on the day of egg retrieval. Okay, so such patients are unlikely to respond to a rescue protocol. Okay, so let's talk about FEFS. It is defined as a failure to retrieve eggs in the presence of low BHCG due to an error in the administration or bioavailability of HCG. Okay, so such patients are more likely to respond to rescue protocol. Okay, so from the two definitions, you could see that one was caused probably due to error on the part of the drugs used, okay, and one was truly maybe as a result of your makeup. Okay, so but evidence has also shown that most of the empty follicle syndrome, most cases of it are as a result of false empty follicle syndrome. Okay, so this means that from all evidences, by the time the treatment is done again, repeated again, yes, there is chances or higher chances that your doctor would be able to retrieve good follicles from you. I know you would want to know more about the possible causes of empty follicle syndrome. Okay, so I will be talking about these causes, combining the genuine and the false empty follicle syndrome together. So my number one reason would be dysfunctional folliculogenesis. Okay, is a situation in which early oocyte extra occur with apparently normal hormone response. Okay, so and my number two would be as a result of biological abnormality. Okay, it's a situation in which the supply of mature oocytes that can be retrieved despite normal bioavailability of HCG, okay, is abnormal. And my number three reason for empty follicle syndrome is genetic factor. in some cases. And my number 4 reason for empty follicle syndrome could be drug-related causes due to an abnormality in vivo biological activity of some batches of commercially available HCG or GnRH agonist. Inappropriate timing of HCG is also there as one of the reasons, or rapid clearance of HCG in the liver. And my number 5 reason for empty follicle syndrome could also be because of age, advanced ovarian aging through altered folliculogenesis. Okay, so these are possible reasons why a woman can experience EFS, empty follicle syndrome. EFS does not predict a reduced fertility potential in your next cycle. Please note that. Okay, so it's actually nothing to be worried about. Okay, if empty follicle syndrome has occurred once, the risk of reoccurrence is 20%. The risk being higher with advancing age. The risk of reoccurrence in patients between 35 to 39 years of age has been reported to be 24% as against 57% for those aged 40 years and above. Okay, so in such patients, donor cycle may be needed to achieve pregnancy. That's the truth. If this has been your problem, empty follicle syndrome, changing the drug or changing the batch of your drugs, or probably even changing to another make of HCG would benefit you. A lot of twerking can also happen that could benefit you. Okay, you know, we do a lot of stuff. We could decide to do a rescue protocol for you. We could also decide to reschedule your egg retrieval 24 to 36 hours later. You know, all these things, we have a lot of them that we just technically do to help you with good follicles by the time you are doing the second trial. Okay, so if this is your problem, all you need to do is to send us a DM and let us help you out for your second cycle. Okay, thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more enquiries, kindly comment below. For consultation, kindly call the numbers showing on your screen. Okay, so don't forget to subscribe to our YouTube channel, and also please don't forget to share this video. Thank you.